evening, everyone. I'm Carlene Motto, Chief Marketing Officer with Belmont Village. I want to thank each of you for joining us today to learn more about navigating the holidays with a loved one with memory loss. Now more than ever with COVID, we recognize how difficult this can be on all of you. At Belmont Village, we are committed to bringing educational topics like today to each of you throughout the year. We want to provide you with the latest research, tips, and guidance as you personally navigate taking care of a loved one with dementia. I'd like to cover a few housekeeping items with you before we start the presentation. All participants will be muted through the presentation. You do have the ability to please forward any questions that you might have to us throughout the presentation through your chat feature on your computer. It is now my pleasure to introduce to you today Mercedes Kerr, President of Belmont Village.
Thank you, Carlene, and welcome everybody. I'm excited to participate today and to meet you all virtually. We have, as of now, 90 something people who have joined us, and the number continues growing. So happy to have all of you and to host you today. Again, my name is Mercedes Kerr, and I'm president of Belmont Village. I was very privileged to join this organization just a little bit over a year ago. So just in time for all of what we have collectively been going through with COVID and the like. And this is an organization like no other, the way that this group of individuals has committed to the safety and well-being of residents and staff has been nothing short of impressive. This company, which was started in 1997, is a developer and an owner and an operator of senior living communities around the country. We have 31 communities as of now, many others underway, and including one in Mexico City. Being from Mexico myself, that was an especially important factor in my decision to join the company. This company has, over the 20-something years that it has been around, not only it started with the very, very focused approach toward memory care, it has developed over the many years very specific programming that is evidence-based and has been really thoughtfully put together with the assistance of a lot of very important research organizations, including academic research organizations. And so we collaborate with the likes of UCLA, USC. We work very closely with UCSF. We work with, the University of Houston, with hospital systems such as Johns Hopkins. So a lot of the work that we are, utilizing the programming that is really at the center of our daily life at a Belmont Village community is very, very studied, evidence-based, like I said, and the likes of which I don't think really exists anywhere else in the country. So it is with that kind of background and with that kind of sensitivity that we wanted to share with you today what our experience has been. And Joyce in particular, who Carlene will introduce in just a moment, will share with us, what we can all do as we walk through, navigate these holidays. For example, when a loved one is suffering from dementia or Alzheimer's disease. So we're very, very happy to have this conversation. We're looking forward to your questions and to your feedback. And without further ado, I guess, Carlene, I'll throw it back to you so you can introduce Joyce properly.
Thank you so much, Mercedes. I also want to let everyone know that we had over 250 register for the event today, some international. We will be recording our session today. So if any of you would like to forward the link to other family members, you'll be able to do that. It's a real pleasure to introduce Joyce Mahoney, who is the Vice President of Memory Programming for Belmont Village. She brings over 24 years of experience helping families, their loved ones, and our teams take care of individuals with Alzheimer's disease or a related disorder. She also has been instrumental in creating our state-of-the-art programs to improve the quality of life for these individuals. Thank you, Joyce.
Thank you so much, Carlene, for the lovely introduction. And it's such a pleasure to be here. And Mercedes, thank you as well. Thank you for attending our presentation today from Belmont Village, Navigating the Holidays with Dementia. And it is our pleasure to share with you some strategies and some tips to help you as family members, as well as caregivers and healthcare professionals to get through the holidays successfully, but with meaning and with purpose with your loved ones that you care for each and every day. At the risk of sounding repetitive through the presentation, I will probably repeat myself on a few points just for emphasis, emphasizing some specific points that I really want to drive home with you. But as we go, please enter your questions in the chat box, and we'll be happy to answer some of your questions at the end. So without further ado, let's go ahead and start talking about the holidays. All right. As we know, going through the holiday season, it can cause mixed feelings for family members, for caregivers, healthcare professionals that are affected by Alzheimer's and other types of dementias. And particularly for family members, this is typically a time for great celebration and family gatherings. And many may experience actually a sense of loss for the way things used to be prior to dementia, being afflicted with dementia. Now, for caregivers, the holidays may also mean a little bit more added work as well. So keeping in mind some of these things on an emotional standpoint that we might be experiencing, we can still get through the holidays successfully for yourselves as well as for the person who does have dementia. So this holiday season, we really want to approach the holidays in a meaningful way to celebrate whatever your celebrations may look like, but also managing expectations and really modifying and simplifying some traditions may be the route to take when you're living or caring for someone who has dementia or Alzheimer's disease. So let's start with some of the strategies for families. I do emphasize here that having a sense of belonging and family identity and maintaining that sense of self and identity for the person who has dementia is really a top priority. So maintaining your family rituals and really instilling those and traditions help family members hold on to those traditions, hold on to that sense of belonging, and really those traditions and that sense of identity that the family holds on to and treasures for all years past and current times, and also for future years. So for a person with dementia, connecting with a family's past is going to be reassuring because of the familiarity that they may be experiencing with the connections. Regardless and nonetheless, with that said, when celebrations or holidays include many people, this can also cause some confusion and anxiety for a person with dementia. So how we celebrate, who we celebrate, the numbers of people, and again, nowadays we have to be safety minded with the numbers of people that we come in contact with, but we want to be very aware of how we celebrate and where we do it, okay? They may find some situations easier and more pleasurable than others, those who have dementia. So again, we want to be sensitive in how we really set up the holidays and how we interact and connect with people, and also including the person with dementia. Okay. Some of the few points that we're going to really focus on today, some of these strategies, are finding the right balance. What does that look like during the holidays? Finding the right balance. None of us can do it all. So again, what is that balance and what can we really navigate well during the holidays? Preparation is going to be key. Preparation in regards to preparing your guests and family members on what to expect when they interact with their loved one who has dementia, but also preparing the person who has dementia for what you're going to be doing during the holidays and who you're going to be interacting with. That's going to be a pivotal point in how you prep. Involving your loved one with dementia, again, just because someone has some memory impairment, depending on what level of dementia they have or what phase they're in, again, involving your loved one as much as you possibly can with the holiday festivities is going to be a meaningful experience. Also, nowadays, we've become a virtual world. So we're going to talk a little bit about virtual connections and what that might look like for connecting virtually with someone who has dementia, maintaining routine and also simplifying your holiday visits, and also self-care, taking care of yourself as healthcare professionals, family members, caregivers. Again, you find yourself putting in a lot of effort and a lot of extra time caring for someone else, and rightfully so, but also taking time for yourself and providing self-care through the holidays is very, very important. Taking care of yourself so you can take care of someone else. Okay. All right. So talking about that balance. Okay. So family members and caregivers, as we already said, you might have mixed feelings about the holidays and anticipating, oh gosh, here comes the holidays. What does that mean? Does it mean more work? It could mean a little bit more worry that you might be experiencing as well, and that's very normal. But again, a little worry and a little anxiety that we have the tendency to feel because we anticipate some of the extra demands that the holidays may put on us in regards to our time, our energy, and our effort that we have to put forth. And focusing really on holiday traditions that are most important to you. So holidays can be overwhelming even when you're not dealing with dementia. And there's so much that we put on our plates and so many demands that we put on ourselves. And this is the time where sometimes we have to say to ourselves, it's okay to step back and let's just focus on the things that are most important to us. Maybe you have a number one thing that's very important, or maybe your top three. But if you narrowed it down, focus on what's most important, what's most meaningful to you, to your family, to your loved ones, and to the person who has dementia. And always remember, none of us can do it all. So let's kind of prioritize what's most important for us and the family members. Okay. Celebrate the holidays that are important to you and include the person with dementia as much as possible. Obviously, we're in the Christmas season, Hanukkah, Kwanzaa. We just finished Thanksgiving. Again, identify the holidays that you want to focus on and the specific things within those holiday traditions that you want to really emphasize and pull family together, whether it's virtually or maybe it's just one-on-one with you and your loved one who has dementia, but really focus on truly what is important to you, that this is the number one thing that I want to do. If I do nothing else during this holiday season, this is what I want to do, and identify what that is. Okay. The self-care piece is crucial for caregivers, for family members, for anyone, for healthcare professionals during the holidays. Again, we overload ourselves. We put a lot on our plates. So please be sure, set your own limits, and also with the limitations, because again, we're not superheroes. We can't do it all. Let's be clear about that also with other people that we may be interacting with or contacting throughout the holidays. And just be very frank and very, very open and say, you know what, this is what I'm able to do. This is when I'm available, and this is how I can do this. But to be very upfront and very clear about your own limitations and your own self-care through the holidays is very, very important, because you matter as well. When we try to find the right balance, when we actually have visiting time with our loved one who has dementia, again, I'm going to focus on, for our presentation today, on simplifying and modifying the different things that we do, but focusing on what's most important during the visit and during the interaction. So a lot of the questions that I get out in the field are, how do we spend time together? How do we communicate with one another? And especially if, you know, my loved one with dementia is non-communicative, or there's some word loss. There's a lot of confusion. They might be able to follow a conversation. So how can I visit, and how can I best visit with that person and make it meaningful and make it special? So we're going to talk about some of those things during this month of December and during the holidays, what you can do. Prepare things together. Okay. those of us who are very organized, you're very efficient, you know, we have the tendency to want to put everything together, have everything ready for everybody. But here's where we can take a step back. When you're interacting with someone who does have a memory impairment, okay, do the things together, prepare together. All the preparations that we do make for the holiday season involved your loved one, okay? Involve the person who has dementia. Do the simple things, identify what their abilities are and focus on that. If you're making cookies, let them help decorate. If you're mixing the batter, let them mix it. If you're writing Christmas cards, let them write a few cards or let them seal the envelopes. Make simple decorations, different little ornaments, garlands, whatever that might look like. Keep it simple, but prepare the holiday together. Again, it's about being together. It's about connecting with one another and making those moments as meaningful as they possibly can. Now, as you spend time together, preparing, enjoying the season, okay, keep in mind also that the person with dementia may have a low tolerance in regards to their energy and sustainability to stay active throughout the day, and they might need some rest periods, some rest time. So when you're connecting and when you're visiting, find a quiet place. Make sure you provide a quiet place where the person with dementia can rest for a little bit, take a little nap, or if there's other people that are all around as well, other family members, you might want to visit one-on-one. I say the one-on-one because sometimes it's maybe that's what the person may be able to handle during the day or at that time of day. And one-on-one may be all they can handle versus a whole group of people, more than 2, 3, 4 people, maybe one visit at a time, one-on-one. So you want to set up a little quiet place in your home to have that happen, okay? During the visits, you want to avoid some disruptions. So make sure that the person is alert, they're rested. You also want to keep things as familiar as you possibly can, okay? Keep daily routines in place as much as possible. So person wakes up at a certain time during the morning. They usually have meals at a certain time. They have rest periods at a certain time. Here's where we're going to have to adapt and modify a little bit. When we're visiting with someone who does have dementing illnesses, they may need rest periods, but we are the ones who are going to have to adapt and modify our routine to fit their needs, not the other way around. And this is an important key right here, okay? You want to plan visits at the best time of day for the person who has dementia and make the adjustments to surround and fit their needs, not the other way around, not to fit ours. They're not going to be capable of making the adjustments, so we're going to have to make the adjustments for them, okay? Plan meaningful activities. Again, it could be something as simple as reading a favorite holiday story, looking through photo albums of past holidays or family photo albums, watching a favorite holiday movie. I know I have my favorites and I have my favorite holiday songs as well. Singing songs together. And sometimes it's even being silly, just reminiscing. But watching these movies and singing the songs, again, can also relate to things that you've done in the past that are familiar to the person. And again, recalling happy moments that you've had before with other family members or with each other. You also might want to consider keeping your celebrations brief. Some of us have the tendency, we celebrate all day long, all week long, all month long, okay? But for the person who has dementia, you might need to keep the celebrations brief. Their tolerance, their energy, their stamina obviously is not going to be the same as yours. So you might want to plan brief little visits. You can plan multiple brief visits, but you might, you have to keep in mind that prepare yourself that sometimes the visits are not going to be long. It could be as little as 10 minutes. It could be 1 hour. It could be a half a day. It depends on the individual. But be prepared to leave early if necessary, or use that designated quiet space for some rest or taking a break. Now, someone with dementia has a tendency, okay, I've had enough, I need to go. They've had enough of the stimulation and the environment, And so just to be wary and remember that when they're ready to go, you're going to need to be ready to go as well. Okay. Right. Preparing the holiday visitors. Okay. This is also another point. If some family members or friends have not seen your loved one who has dementia, if they have not encountered or have had any visits in quite some time, you might need to explain to family and guest members ahead of time what they can expect about any of the changes in behavior and memory since their last visit. They remember the person from the last time they saw them. It could have been a week ago, a month ago, a year ago, and things have changed since the last time they visited. So it's always nice to prepare them and say, hey, this is what you're going to see when you visit with your family member. This is what you're going to expect. Okay. They can't hold a conversation the way they used to, but they can sit and they can listen and they can laugh and they can hold your hand. Also focus on the things that they're still able to do. So prepare them and let them know what the encounter may entail. Okay. You're also going to want to offer some communication tips. Okay. So you might want to suggest ways to listen patiently. Okay. Sometimes residents or people with dementia illnesses need additional time to respond. So when you're talking and trying to have a conversation, there might be pause time, intermittent time, where they're thinking about how to respond to what you said. So you need to listen patiently and give them enough time to respond. We don't want to criticize repeated comments. They might repeat things again and again. That's okay. We'll just pretend that we heard it for the first time. Also, if they talk in conversation and there's errors in their conversation that doesn't seem to be making sense, we certainly don't want to correct them. We're just going to go on with the conversation as though there were no errors, and then not interrupt. So you want to make sure that when they're talking, let them speak, let them finish speaking, and then you can respond when they're done. Okay. Also, for your holiday visitors, you might want to suggest some activities and how to interact and how to engage with them while they are visiting. So you can have planned or suggest that they planned activities, or you can suggest that they bring something with them. Again, I kind of go back to the old standby with the photo albums, singing some songs, playing some music. It could be even just background music that is nice and calming and relaxing. Taking a look at some family ornaments, some memorabilia, from holiday decor, and reminiscing about that. And maybe your loved one actually purchased that, or they gave it as a gift and you want to show it to them and you can talk about that item. But you do want to emphasize that the meaningfulness of the moment together is what matters most. And I do want to emphasize that. Be in the moment. Anytime you visit, whatever the visit looks like or whatever you're doing during your visit, it's the meaningfulness of that moment. It's being present in the moment. Okay. That is what's going to matter the absolute most. Now, we also want to prepare the person who has dementia. Prior to your visits, now again, I realize this might sound a little contradictory. I know there's memory impairment, short-term memory loss. So, this sounds like it might not make any sense, but it will work, okay? Ahead of time, prior to your visit, you may want to start preparing the person with dementia. Now, again, if they have a mild cognitive impairment or early stages of dementia, this will work really, really well. Even for a little bit more moderate stages of dementia, this would work well to actually start prepping the person prior to the visitor's arrival. Start showing photos each day. Start mentioning people's names. Talk about family members and guests who they might be encountering, showing the photo of that person, saying the name, and repeating and just kind of rehearsing who they might encounter just to prepare them for the visit. This also might encourage them to be a little bit more calm, more receptive to visitors, knowing what to anticipate. So that's the whole idea. You want them to know what to anticipate, so there's no nervousness and minimal anxiety when they're around multiple people, okay? You also might want to arrange and set up a phone call for the person with dementia and the visitor. So if there's a special person that they're going to be visiting, sometimes, again, hearing the voice of that person, talking about familiar things that they used to do together, making that initial connection before the physical visit happens. You might want to do a phone call or even a virtual call, do a Zoom or a FaceTime to actually put the face with the voice would work really well. Okay. The call gives the visitor an idea of what to expect. That's the whole idea behind this, what to expect and what to anticipate during the visits. Gives the person with dementia an opportunity to become familiar with that person. And again, in all of these cases, familiarity is going to be the key. Familiarity, the routine, the meaningfulness, the moment, that's what you really want to focus on. So keep the memory impaired person's routine as close to as normal as possible during all the visits. And even during the hustle and bustle of this holiday season, we really can get very tired. We can get fatigued. So we want to make sure, not only for ourselves, but the person with dementia, make sure that there's adequate rest for all persons involved. All right. Okay. So preparing the holiday with virtual connections. Oh my gosh, we've become a virtual world this past year. Not that we haven't done it before, but even more so now. Zoom and FaceTime communications have become commonplace. But now when you want to do virtual communications with your loved one who has dementia, I can't emphasize enough, practice, practice, practice. Even for, a newcomer, even without dementia, trying to use Zoom and FaceTime, this is technology. It may be new to them. They've never done it before. So please do the rehearsal runs and introduce the Zoom or the FaceTime, whatever it is that you're using to communicate. You need to practice that multiple times with the person who has dementia to get them familiar with the concept, okay? You're going to need a lot of time to really conceptualize, so the person can conceptualize and grasp the concept of this new way to communicate. What might happen if you don't do this, if you don't practice and familiarize in advance, sometimes when they're looking at the screen, say if you're using a tablet, they might think it's just a picture frame, a photo frame, okay? And they realize that it's not a live person on the other end of this. So it's very hard and can be very difficult to grasp this new concept of, wait a minute, I'm talking to an inanimate object, but it's really a live person on the other end. So this is the dementia that you're dealing with. So practice, practice, practice is going to be key in this situation, okay? Now, when you are doing the virtual communications, my recommendation is to begin with one-on-one communication and avoid multiple persons on the communications on the Zoom or the FaceTime, okay? That can be extremely overwhelming for the person with dementia. I would suggest practice one-on-one, okay? Even after the practice, you might want to keep it, depending on the person's ability and their capabilities, you might still want to keep it one-on-one versus multiple people on the screen. It'll be much easier to focus and to understand and conceptualize, okay? Schedule and span connections around the best time of day for the person with dementia. Again, you don't want it probably later in the day where they might have been up all day long and they might be getting tired. Pick the best time of day where they're alert, they're rested, maybe right after a meal, maybe after breakfast or after lunchtime. But pick and schedule the best time that's going to work for that person, and then set your schedule around that to make sure you have a really nice interaction, okay? Another suggestion would be is that depending where you live, if you have it in, if your person lives in home with you, you can set up a room and create a Zoom room. So it's a quiet space with your device, whether it's a tablet, it's a laptop, or sometimes you can connect it to your large screen television, so it's bigger and it's easier to view. But you want a quiet space without distractions, and then use a larger screen monitor so it's easier for viewing. So you can create your own Zoom room. How fun is that? Involving your loved one during the holidays, okay? Celebrate the holidays that are important to you, as we said earlier. Include the person with dementia as much as possible. This is not, a situation where, oh no, they have to sit and just watch. They can do that, and that can be just as meaningful depending on what their abilities are. But you do want to involve the person with dementia with simple holiday preparations, or have them observe your preparations. So 2 different ways. They can observe you, which will familiarize them with the upcoming festivities. So as you're decorating your home, or you're preparing foods, or doing some baking, wrapping presents, they can observe you, okay? Or they can participate right along with you if they're able to. That also may give the person the pleasure of helping. So they have a sense of purpose and meaning within the holiday, and they feel that they're part of something more and helping out, and also have the fun of anticipating and reminiscing as you're doing your tasks, your holiday tasks. So keep them as involved as much as you can, so you can determine whether do they need to only observe and that's meaningful enough, or are they capable of actually participating in some of the activities and preparations. We talked about maintaining routine as much as possible. So keeping the person's routine as close to normal as possible is going to be key. We also mentioned that their stamina might vary a little bit, and it might not be what it used to be. So they might need frequent naps, frequent rest periods throughout the day, and that's okay. So they might have their prime times during the day, and those are the times that are going to be best for visiting and interacting. So plan activities with your person with dementia, enjoys in your daily routine, and try to do them at similar times every single day. Routine and familiarity is going to be key. Sometimes when we step away from that familiarity and that routine, it could throw them off and cause a little bit nervousness and anxiety and a little added confusion. So again, keeping to that routine is going to be best, okay? He or she can also be part of the activity or just watch, as we mentioned a moment ago. Match the activity to their ability. So again, provide them something that's going to be adherent for successful participation. If it's mixing the dough, if it's singing a song, if it's making an ornament, if it's helping decorate the tree, if they're capable and they have the ability to do so, then match the activity with their ability and involve them on that level, okay? You might have to help the person get started. They might not have the ability to initiate or start an activity unless you help them get started. It's actually called a starter button. So they lose the ability to initiate things. So they might need a little cueing, a little encouragement, a little prompting to get started and whatever it is that you might be doing with them. So don't be afraid to give them that little nudge, okay? Decide if they can do the activity alone or if they need help. Sometimes once you get them started with an activity, that's all you need to do, and then they can take it from there. If they get started and then they stop the activity, so for example, if you're making ornaments or decorating the tree and then all of a sudden you notice that, they stopped and they went and sat down again, they might need a little bit more encouragement, and they might need more prompting and cueing to get them started again. You may have to repeat that every now and then so they stay engaged, but every now and then they'll get going, let them go as much as they can. If they stop, give them a little prompt again, okay? All right. No matter what you decide to do during your interactions and during your visits, make sure that your loved one feels successful and there's a sense of fun, playfulness, and enjoyment in whatever it is they do. That's what the holidays are about. It's being together, it's having some sort of connection, and having that little fun and frolic and little festive moments. But you have to be successful or feel successful in what you're accomplishing to avoid any type of frustration or aggravation, okay? Let him or her watch if that's more enjoyable. Again, if you're noticing that you want to encourage them to participate, but they're still kind of pulling away, that's okay. let them be. You continue doing what you're doing, whether it's baking, it's decorating. And if it's observing that they do the best, then that's fine too. They can be very content and enjoy watching you decorate or prepare for the holidays. Okay. Simplifying the holiday. Part of simplifying is also creating a calm and relaxing environment, okay? When we decorate, and again, we all have our own ways of decorating for the holidays. Some are minimalist, some go way out with the decorations, okay? But when we are involving someone who does have dementia, you might want to consider softening some of the decorations that you have in the home, especially if you're going to be using that environment for visits, okay? So softening or minimizing the decorations in regards to blinking lights, large decorative displays that could be overstimulating. You might want to pull back a little bit on that. Less is more in this case, okay? It will still look gorgeous, it'll still look festive, but in order for the resident or the person with dementia to be able to tolerate the environment, you may need to consider to minimize some of the decorations so it's not overstimulating, okay? The other thing when it comes with decorating, you want to detour from rearranging a familiar room to fit the decorations. It needs to be just the other way around, just the opposite, okay? You need to lessen the decor to maintain the familiarity of the environment. The environment itself needs to maintain familiarity for the person with dementia so they feel that they're not in a strange place. They feel that they belong, that they can identify things within the environment and still feel relaxed and comfortable so they can navigate that environment comfortably without stress. So again, kind of changing and altering the room considerably might be a little bit too much. You still have to maintain some familiarity so they can move about freely and they can move around without stress and the environment still remains familiar. Okay. To simplify the holidays, when you're decorating, when you're visiting, familiar or favorite holiday music may be enjoyable. You might also want to consider the volume to be relaxing so it's not so distressing or overwhelming or overstimulating as well. So consider the volume of the music in the environment. All right. Holiday gift giving. This is a question that I get quite a bit. You know, what do I get someone who either has everything or if they have dementia, what is it that they need? What should I purchase? So gifts that provide a sense of fun, enjoyment, and comfort for the person with dementia are highly suggested. So some suggestions, and again, these are just suggestions, not limited to, but you can gift wrap a special family photo and reminisce stories and events from the past, identify family members who are in the photo. That's always a beautiful, beautiful gift that really can promote conversation, reminiscence, memory recall, something that they can have in their room, something that they can hold in their hand and look at often. Also, on a more practical level, some nice pajamas, bathrobe, comfortable clothing, weighted blankets, sweaters, something that provides warmth, comfort, depending again demographically where you live. Maybe it's not a heavy blanket, but it might be a light sweater. I mean, their favorite color, something like that. Sensory type gifts might be a nice thought, again, for someone who has more moderate to later stages of dementia. You can purchase a diffuser with different scents, citrus, lavender, even during this holiday season, frankincense. Sometimes chimes are a nice addition to a room, nice soft little tinkling chimes. Calming lights, there's different types of lights that you can purchase. LED lights, you can have lights that show different designs on the walls, different colors that promote calm and serenity. Echo Dot to play music, you know, you can play their favorite music, soft blanket in their favorite color, a furry hand muff, sometimes, you know, something tactile to put their hands in, but you can purchase a hand muff. So it'd keep your hands warm, but yet it's something tactile to touch as well. There's also the perfect pet. It's not a live pet, but you can even purchase pets that are animatronic, oh my gosh, I'm getting tongue-tied. Pets that are battery operated, but they move around, they make noises, you can pet them. They make nice purring sounds or little, little whimpering sounds if it's a little cat or if it's a little dog. Those seem to be nice and comforting to someone who has dementia, and they may think that they're real. They have a realistic movement and sound and touch to them. So that's always a comforting gift idea. And also scented hand lotions. So you can always put those hand lotions on, make your skin nice and soft and smell good. So those are just some suggestions. Okay. And again, I can't avoid talking about safety. This year has been a year of COVID-19, and again, identifying the safety factors when we're visiting this holiday season. Obviously, risks are higher when you're visiting indoors, especially if the space is small or poorly ventilated. You can reduce some risks by taking certain steps, as we have listed here. You do want to limit the gathering size depending on your local rules and jurisdiction. Keep windows open if you can, if it's not too cold out, to improve the ventilation, and of course, avoid physical contact and wearing masks that cover both the nose and the mouth. Okay. Now I know this might be a challenge also for the person with dementia. Sometimes they don't like to keep it on, but encouraging them to keep it on as much as they possibly can, and then sanitizing your hands constantly, but making sure all the other visitors that are in the vicinity of that room, of that visit, they also have their masks on at all times. Staying away, staying apart, 6 feet apart, social distancing, especially with people who don't live in the household. So other people that may be coming, don't recommend that, but if that does happen, you have to stay 6 feet apart. Washing hands before eating, using disposable towels, disinfecting surfaces in the house, and of course, limiting the amount of time that you spend at a gathering. The longer you attend a gathering, the higher the risk. Okay. The other question that I get too is, how can I enjoy the holidays if I can't celebrate with others? So there's many of us that are going to experience this year. And these are just a few suggestions. If you practice the religion, you can watch religious services online. Making holiday food, decorating, put up the things that are meaningful to you, pull out photo albums, making a scrapbook of holiday past, sharing recipes. You can share dinner time over Zoom, and the recipes that you share with your kids or grandchildren, make the same recipes and then connect via Zoom, and then you have your dinner together. Savor past holiday experiences. So again, watching videos, recalling the smells and the sounds. Maybe you have cinnamon tea or cinnamon scents in the house, or cinnamon candles. You can burn those, and again, just brings back those memories. And again, imagine the next holiday and how good it will feel to celebrate with people and with others. Hopefully next year at this time, we'll be able to be together, everybody. And again, we've had a challenging year, and we've really faced it head on. And there is no doubt each and every one of you on this presentation, on this call, have proven that you're extremely resilient. So just be safe out there and enjoy the holidays. Okay. Thank you so much for joining our presentation with Belmont Village. We wish you and yours a very merry holiday. And thank you so much for listening to our presentation.
So, Joyce, and we're not going to leave just yet, because we're going to have some questions, and we've had many of them while you were chatting. And so we'd like to address them. So I want to make sure that people know that they are on our radar and that we're ready to jump in with some answers. So the presentation today, I would start by saying, is both for family members of residents who live with us. And we're very happy to touch on some of the specifics of life at Belmont Village just during the holidays, and then life at Belmont Village in a holiday period that has COVID. And we do have some general information that we can share with you, and then we can share more specific information separately of what's happening in your own individual communities. And so we'll be happy to touch on that in just a few minutes. But then also we have people who are familiar, they're friends of Belmont Village, yet their loved ones do not live with us. And so they are trying to figure out how to adapt and make sure that they are safe during this holiday season. There is no question that in addition to all of what we have endured together during this COVID pandemic, we are right now in many locations in the throes of spikes. You know, we have higher number of positive cases in our midst, depending on where you might be joining us from. And so for all of those reasons, we have very comprehensive protocols in place, and with a very high priority toward trying to figure out how to make those connections, those personal connections with loved ones, whether it's virtually or in person. You can rest assured that we're doing everything that is appropriate and well advised and thoughtful to make sure that those connections exist. And I'll let Carlene touch on that in a moment. But nothing at this point could be more important than maintaining that social distance. I do believe it is a year of very, very small celebrations, you know, maybe just with that core group of people that are in your so-called bubble for many of us, so that we do, you know, prevent any unnecessary exposure, especially to all of those whom we love and might be more vulnerable. Just as an aside, I will tell you, though this presentation is not about that, we're very excited about the advent of vaccines and other possibilities. We do tremendous amounts of testing at Belmont Village, which I think is, it goes at least a long way, not all the way because it's impossible, but a very long way toward preventing, you know, any unnecessary exposure. So we're doing a lot of things at Belmont Village. And I'd like to ask Carlene, before we jump into other questions that people have asked, which we will also address, I'd like to ask Carlene to maybe add to what I just said.
Sure. Thank you, Mercedes. And as Mercedes said, the 250 participants that we received, the majority are taking care of a loved one still at home, considering moving to Belmont Village in the near future. As Mercedes said, when we talk about, you know, safety, everybody is celebrating differently this year, and especially for all of you that may even have a loved one living in a community that's not even a Belmont Village. We know that that population, especially since with the Alzheimer's diagnosis, is very vulnerable. Every single local Department of Health and state guidance tends to be a little different. So I would strongly encourage you, depending on where your loved one lives, that you work with that executive director and that local team to talk about visitation policy, and also especially around the holiday. As Mercedes said, I think the biggest gift that we received today, and actually everyone received, is that hope is on the horizon. 2 vaccines are likely to receive FDA approval by mid-December. Last week, a panel from the CDC overwhelmingly recommended that our workforce and our residents be at the top of that priority list for distribution. And today, the first of those vaccines from Pfizer received approval from the FDA. This is extremely important to all of us. So again, what I'd like to do is open it back up. We've had about 10 questions that have come in through the chat. Some we have answered, and then some we'd like to address with all of you. But most importantly, there were questions around, can we get copies of the slide presentation? We have recorded this. We will send the presentation to each of you. The recording is also available if you'd like to forward to your families. And then most importantly, I hope, besides the hope with the vaccine, I hope that all of you feel like even though holidays will be different for all of us, there are ways still to connect with your loved one. And I could speak specifically at our Belmont Village communities. Our directors of memory programming are there to help facilitate those Zoom calls with your loved one, FaceTime with your loved one, calling them anytime for questions to stay connected, delivering gifts that we can make sure that we celebrate with your loved one. Two gifts that I want to share that I have loved ones with, also with mild cognitive impairment, that I shared last year with them that's been really beautiful. One is called Skylight. And I don't know if you're familiar with it, but it's actually a picture frame. Very easy. You are able to download photographs from wherever. So if the skylight was in your loved one's apartment at a community that they're living in, or if they're living in our neighborhood or circle of friends, we would be able to put skylight there, and any one of your family members would be able to download photos right from their phone to skylight. So it's wonderful to always see those images, pictures. Of course, we find that pets are wonderful and they do beautifully with pets. The tactile stimulation, so anything like a blanket, even blankets now that you could put photographs on, are something that's great for reminiscing. So Mercedes, I'm going to turn it over to you to also address some of the questions that are coming in that Joyce can answer, or any one of the panel members.
Perfect, perfect. So you talked for a second there about Zoom again, Carlene, and I know Joyce, this was part of your presentation, but we've had more than a couple of questions actually on that very topic. And can you share any more specific tips on if I am going to want to have some sort of connection, with my family member by Zoom? And, like Carlene said, that's something that we facilitate all the time, every day, frankly, at Belmont Village for people who live with us. What other tips should we keep in mind? If I have 4 family members, 5 family members on the line, fine, we could take turns speaking. What kind of tips can you share to make that interaction most successful?
And again, I go back to doing one at a time. I think you're going to have family members who, oh, I want to talk to grandma, or I want to talk to grandpa, it's my turn. But scheduling those times, so maybe the best time of day is between 11 and 12, 11 a.m. and 12, it's like, okay, I'm going to call grandma at 11 o'clock to 11:15, and then just kind of intermittently go ahead and schedule one at a time. You can do 2. It depends what the person can tolerate. But if can also be someone on the other end to help them turn the device on, to help connect, because sometimes they're not going to be able to connect on their own. So you need to have someone by their side on both ends to help navigate that process. So if someone can turn on the device for them, connect, and then here's the faces, and then, they can talk. That's usually the hardest part, is connecting the device.
So one of the things, Joyce, I had a Zoom last week with my family. My mom turned 80, and her brother-in-law and sister-in-law both have early stage onset of dementia. And on the Zoom, what we found that worked was the reminiscing. They, again, obviously their spouses were with them, but we gave each family an opportunity to kind of reminisce about a funny story about my mom, and they seemed to really enjoy that. The other thing that seemed to keep them engaged during the Zoom was everyone brought their pet. So it seemed like all of a sudden a family member each had a pet on the screen, and they loved that. So again, pets, children, babies, any of that. So again, I think that most importantly, it's just, again, that expectation. It was fun. Again, we made sure that we delivered a little pizza to the house, and everyone had a slice of pizza during the Zoom. So again, it's not going to be perfect, but I think that time, just to be able to reminisce about, old stories, they love sharing, and it's a great opportunity.
Yeah. The other piece of that too is, also, my father just turned 85. He also has some mild dementia. We also did a Zoom with the family, and he couldn't really conceptualize the whole concept and how it worked. But in all the little squares, when he saw everyone's little faces, he just started naming everyone. Oh, there's Danny. Oh, there's Richie. Oh, there's Kathy, and then we just kind of let him kind of go through all of that and naming, and he had the biggest smile on his face, and he was just so thrilled to see all of their faces. But just identifying every single person on the screen, he got a kick out of it.
That's great. So just moving on to some other questions, there are questions related to support systems, whether it's where can I find support to learn how to relate to my loved one who, is frequently forgetting what we've talked about, or the, agreements we have come to among ourselves or with others. And so there's confusion there. But then also just generally, support to educate not just oneself, but also the other family members and friends who might be, having a difficult time recognizing that somebody that they care for is suffering and starting to decline and suffering from dementia. So what can we talk about there with respect to support systems?
The support systems, I mean, I was, at Belmont Village, you can always reach out to Belmont Village and we can help you navigate some of that support and guide you along and answer the questions and educate you about the process, the disease process and what's happening, how to communicate. But, the family members, typically need a lot of support. And having a venue to be able to talk and to kind of discuss and what they're feeling, what they're going through as a caregiver, as a spouse, as a child. There are support groups that we will offer in many of our Belmont villages or local organizations that you can have, you can join support groups. Now they're doing it via Zoom calls as well, but there's local agencies as well, the Alzheimer's Association, local hospitals, even calling your physicians. They can also guide you into where to find a support group.
Great. So I guess we have maybe time for one last question. And I'm afraid that this is a little bit about vaccines and all of that as opposed to memory care. But the question is about whether we are considered to be in that first tier of the facilities that will receive the vaccine. And I can tell you that, we are going to, we're already starting to receive notices about for the appointments that are going to be required for the providers that will come to our communities to actually, administer those vaccines. And so we are working very diligently in that process. So given that I answered that, I guess, in just a few words very quickly, maybe, I don't know if there's time for one last one, or maybe Carlene, some parting thoughts from you. How about that?
So a couple parting thoughts. One, when we've done this live in the past, a really great piece of advice I heard from a family member. He said, think about when you were on a plane. And I know for all of us, it's probably been a very long time. But when you're on a plane and a flight attendant says, okay, if we lose, air control and we needed the oxygen mask, please put the mask on yourself first, then your child. It applies also to caregivers. You guys have to take care of yourself. So for all of you that are still struggling to take care of a loved one at home, make sure that you take care of yourself. So during the holiday, call upon friends and family to still help. And even if it means calling your loved one that's at home to talk on the phone, to give yourself 5 minutes, 10 minutes break to be able to do that. Because so many times we see the caregiver themselves get sick. The other question is about hope. One of the questions that came in that said, I'm considering placing my loved one at Belmont Village in the next couple weeks. Will she still be able to get the vaccine, or he? Yes. We do not have the dates yet, but we are working with the local CVS and Walgreens to make sure. So again, this is an opportunity for you to make sure that your loved one moves into the community before the holidays and they're with us through the holidays. We want to do everything to connect families and their loved ones together, but our biggest priority right now is safety. And with COVID, we need to make sure that we're doing everything possible to keep your loved ones as safe as possible. There are so many touch points during the day when your loved one lives with us, with our enrichment leaders, our dining room staff, our caregivers, our nurses, to make sure that they have that interaction and they have that commitment to high quality care. So on behalf of everyone on the panel today, I want to thank Joyce, Mercedes for joining us today. Most importantly, I want to thank all of you for taking time today to join. Again, we will have the link available to you. And we want to wish all of you a very joyful holiday season, and please take care of yourself and stay safe. Thank you so much.